what I wanted to share was share some of our pilot findings from our current project where we're looking at how to learn about teen preferences for receiving opioid safety education in their classroom or at home. One of the things I found from my work is that a lot of times we design a lot of these prevention programs for teens, but often at times there's not a lot of their perspectives and how they want to learn about that information. So I'll be sharing what we found so far. And I'm happy to take questions as I go. That will be way more interesting than listening to myself. So essentially, my lab is really interested in figuring out ways to increase youth medication literacy for prescription opioids and for other medications that they're likely to misuse or have to take if they have an acute or chronic condition. So those are the range of things that we work on and trying to figure out creative ways to facilitate their learning about medications. So many of you are probably familiar with this. Opioid misuse starts at home. Often at times it starts from very young ages, as early as 12. And we know that even from our work in the Wisconsin schools. When we started this project, we were focused more in high schools, and we got significant requests to start collecting some of this information in middle schools because it was happening a lot in some of the middle schools in the districts that we worked with. So essentially what we did is we took what I would consider a mixed methods approach, where we partnered with 3 schools in 3 different counties, one school in Dane County, one school in Milwaukee County, and another school in Clark County. And we targeted youth that were age 14 to 18. And essentially when we go into these schools, what we have the teens do is fill out our first brief survey that takes about 8 to 10 minutes to complete on their phones or their Chromebooks. And then for those who are interested, we do follow-up focus groups that typically might have 5 to 18 to 2 people in my research team. And these focus groups I find them interesting because we start off with them kind of diving more deeply into some of the information they filled out on the survey. And then the second part of that is we have them design a game that they would like to play to learn more about prescription opioid safety. So I'll share a little bit about later why that might be relevant. Over time, from my work looking at teen preferences for medication education, game-based learning has come up a lot. So my lab works a lot on trying to figure out what are different ways they could use games to learn that will still be interesting to them. For this current study where we're at before the COVID situation occurred, we were able to do 190 surveys, and out of those surveys, 54 of those teens chose to participate in 8 focus groups. So in each school, we had about 2 to 3 focus groups. So essentially what we found is a lot of these students were able to talk about the fact that they knew what opioid misuse was. So that's pretty important in the sense that they're able to tell you, we shouldn't be sharing medications. We know misuse involves taking higher than prescribed doses or taking medications that weren't prescribed for us. One of the things that I thought was noteworthy that kept coming up is about 20% of them will still consider using another friend's prescription opioid if they felt like it will help them. And so I thought that was noteworthy. So one of the things we've done in the game intervention that we're creating is to dive more deeply into why you might not want to use your friend's prescription medication. A lot of the students were able to talk intelligently about the consequences of prescription opioid misuse in terms of affecting physical health, mental health, their ability to do well in school, or damaging relationships. One key thing that has been interesting to me as a pharmacist is during a lot of our focus groups and surveys, one of the things we learned is that this idea of appropriate disposal of prescription opioids, and storage is a piece that the youth are not as familiar with, or what to do with expired medications, or how to properly store or get rid of medications, that prescription opioids that they're prescribed. So one of the things we've also are doing in the game intervention that we're developing is to highlight this more, because this is one piece that I would say a lot of the youth are not as familiar with, or they feel like no one ever talks to them about that. Another key interesting thing that for us is, how are they getting information about opioid medications in general? As you can see on this slide, a lot of it is from the internet, good or bad. Some things that were interesting is they're learning a lot from TV shows, which was one that we hadn't thought of in the past, and that came up more in the focus groups than even in the surveys, because we didn't have that on our survey. They learn a lot from parents, as you can imagine, and really want to learn a lot when they're prescribed medication, so from their doctor or from the nurse. One thing that we found interesting is a number of them were, about 20% were willing to explore a game-based approach, which was interesting to us. But one of the key things that we kept hearing was this idea of being able to interact with someone who has had an opioid addiction experience, and having that either as an instructor-led session, or having that as a video that they can watch and talk about. So that was a key finding in terms of their preferences for education. So now I'm going to segue to a few quotes that I thought were interesting that I've pulled to share on here. One that was notable was this idea about sharing medications, and what I'm sharing now are quotes from the focus groups. So one key thing that came out in terms of their perceptions about misuse was around when they receive medications that has been prescribed to a family member, and that's given to them by a parent. So that's what that first quote is referring to. Another thing we quickly picked up on is that a lot of these perceptions really come from their interactions with what they're seeing their parents do. So if the parent gives them that medication, then they think it's okay to use it. In terms of disposing medications, if they find their parent, the second quote talks about, if my dad flushes it down the toilet, then I might think that it's okay to do that. So, and same thing with storage, and just their behaviors were highly linked to what they see being done in the home by family members. Following up on some of the reasons for misuse, a lot of them talked about, just having mental health struggles or stress or influence from family or friends, and wanting to even be pain-free. So they were able to talk pretty well, I would say, about some of the reasons for misuse. And also along those lines, some of the consequences. So I would say, as you could see in that we saw in the survey and also in the follow-up focus groups, that they were able to articulate a variety of negative consequences on opioid misuse. So I thought that was a good thing. In terms of sources of information, just following up on what we saw in the survey. In the surveys, like I said, we hadn't had the option of television, but one of the things we quickly found out as we were having these focus groups, that yes, they're learning from family, healthcare professionals, online websites, but really a lot of the shows, they're picking up a lot of information about opioid prescriptions and misuse from a lot of television programs. So that was an interesting one that we hadn't thought of on our research team. Along those lines, we were able to also dive in the focus group into some misconceptions that they had about opioids. Very quickly, we recognized that when we started to ask about tell us examples of opioids that they tended to have confusion in terms of some drugs like Xanax or Advil that they thought were opioids that were not, or even what opioids do. For example, you have on here a teen saying it helps you think. So again, we recognize that they had some misconceptions about what opioid medications were. And this is pretty interesting because in one of our schools in Milwaukee, the students had actually just gone through about a week before an opioid education session. So again, it brings to light having a way to assess if they're learning what we think they're learning. In terms of preferences for education, the focus groups really helped us to dive into what would they want this to look like, and having a lot of sessions where they're having someone talk to them and who's had that experience, or having opportunity to watch a video and talk about it as a group really came to light in these sessions. Another key thing here was making these sessions mandatory and having some kind of incentive to learn about these topics. What I have on this next slide is kind of what we thought was interesting in the second half of the focus group. We have them kind of design what a game might look like that will be interesting. And these are just some pictures of a variety of things that they came up with. What we've done with some of these graphics that you see on here are storyboards or scenarios or characters that they might want to see or find interesting. And what we've done is we've taken some of this information to create a prototype game that we have called MedSmart. That's what you see on this slide. And what we're doing right now is incorporating some of their ideas into this prototype. And our next step is to kind of go back and pilot this to see if it's doing what we envisioned it to do. And I just have graphics of the game. So in the game, we're creating like a home scenario, school scenario, trying to kind of mimic what they might see, what they might experience. And so I'm going to stop now because I wasn't watching my time. But essentially, we think that a lot of prevention programs that we're targeting, that are targeting teens in school, can benefit some about learning about where teens are currently at in terms of their understanding of prescription opioids. And we think that this game-based approach, really what we saw even in the focus group sessions, is that they're learning from one another. It eases kind of the intensity of the topic. So it's something that we'll keep pursuing. It really changed their learning process when we did this in the 3 different schools. They were more open to share about experiences and listen to one another.